I'm delighted to be here and to be able to give you some insights from Best Beginnings and some of our team who are with us today about the role that digital can have, but really focusing on the how. So I'm going to focus on Baby Buddy, which is an NHS accredited app which was launched in 2014, and it's had over 200,000 downloads to date, using Baby Buddy as a case study, highlighting some of the key principles that we feel are necessary if a digital intervention is going to have reach and impact. So at the end, I'll come back to this slide and we'll see whether I've covered the take-home messages. We're all energised about the potential that digital have. I hope when you see what we've been achieving collaboratively, that energy for the potential will only be enhanced. And I also hope that there will be even more of a focus on the limitations and therefore the work needed to be done to overcome them, to realise the potential of digital. There are no magic wands, things don't do themselves, but with a strategic approach, with clear purpose and clear frameworks in terms of behavioural change frameworks, and with a commitment to iterating and to learning from data, we can empower the population, improve outcomes, and reduce inequalities. So I'm going to tell you a little bit about the approach we take as a charity as a whole, and then dive through into Baby Buddy and how we deploy that approach and have been doing since 2011. So as a charity, our purpose is to reduce inequalities in child health and give every child the best start. We focus on this wonderful window of opportunity from preconception to the 4th birthday, where we know the evidence for a happy and healthy life are laid. Your purpose might be something very different, whether you're looking to support someone with diabetes to maintain their blood sugar levels, looking to support someone to reduce their weight, or helping many of us increase the amount of sleep we get every night. The guiding principles that have been there since I founded the charity apply today. Innovation is key. Apps currently is where it's at. It may not be in the future, and it's moving with the times and thinking about the power of content which can move across platforms. We're passionate about film, the power of film to transform people's eyes, kind of open eyes to possibility, to transform thinking, the show how approach, the not tell to, the peer-to-peer voice that can really shift not just knowledge, but motivation, and that's what you need for behaviour change. Evidence is crucial, so we've always worked from the evidence, and we have been and continue to be committed to contribute to the evidence, to establish the efficacy of what we do and share that and learn. And in the middle is the most important principle of all, and that's of collaboration. No individual or organisation or even groups of organisations within a sector can drive lasting change. What we need, if we're going to really shift things to increase agency, self-efficacy, enable citizens of all backgrounds to get the most out of their life in terms of taking control of their health and effectively using the health system, kind of really, if you think about the NHS long-term plan, this brilliant focus on prevention, but really using digital to make it happen. If we're going to do that, we have to work cross-sector. That's our belief at Best Beginnings. And we're really proud over the last 11 years to have consistently worked with so many different groups of people and to pull in knowledge and share knowledge and pool knowledge. For example, the whole field of implementation science and behaviour change is enormous. Just look at the growing literature. And over the years, we have shifted in the models that we have focused on. But for some time now, we've been using the Susan Michie, the Michie et al. Behaviour Change Wheel. I don't know how many of you are familiar with it, but we really like it, both in terms of thinking about developing an intervention and deploying it, and also to use it as an evaluation framework. So our change models may have changed over the decade, but this three-stage approach, this iterative circular approach hasn't changed. So over the years, we've made 5 national resources, and I'm going to home straight in on Baby Buddy after I outline the 3. So we create national resources with the core principle that they should be free to families and advert-free. We then work within localities to integrate them, to make them fit for purpose for the needs of that locality. And across both, we're learning, letting data flow, that combination of academic evaluations, which we've heard don't really take place at the speed that we need for digital interventions, but also data flowing from digital resources. So now I'm going to tell you a little bit about what Baby Buddy is, otherwise I'm going to be talking about this app that maybe not a few have had a chance to play with, and then I'm going to explain how we built it using this co-creation, user-led approach. So it's a free NHS-accredited app that we designed with the purpose of directly informing and empowering parents of all backgrounds to have the knowledge and confidence to look after their own mental and physical health and to maximise their baby's potential. As a film lover, 10 years at the BBC, I have to show you a little short clip to give you a flavour of it, but also you can come and see our team. We've got a giant iTab out over lunch to see a bit more of it.
Are you a new parent or about to become one? Baby Buddy is the free award-winning mobile phone app for parents-to-be and new parents. Create your own personal baby expert who will guide you through your pregnancy and the first 6 months of your baby's life. Baby Buddy has been created with mums, midwives and doctors, so let them tell you more.
As soon as I wake up, I know that there's new information, so I just quickly click on it.
I can put the appointments in to help me remember that I've got to be at a certain place at a certain time.
Just not only track your progress of pregnancy, but also ask questions.
This app really is what I call the future of healthcare.
Over 99% of mums find Baby Buddy easy to use, and 99% finds it helps them feel more confident about caring for their baby. If you know about the Heads Together campaign and you want to know more about how to look after your physical and mental health to give your baby the best start, then why not download Baby Buddy for free today?
I have to say that was filmed before Dr. Ranj was famous because of his appearances on Strictly Come Dancing. That gives you a flavour of Baby Buddy. We were very clear about what it was and what it wasn't, and we're steadfast on that. Baby Buddy isn't instead of anything. There might be those of you out there thinking to develop an intervention that will replace something, and that's absolutely fine as long as you're clear what you are trying to do. We're very clear that Baby Buddy is there to augment and amplify what's already there, to directly inform and empower parents, and to support contact points with professionals. This as well as, not instead of approach. And I guess another key principle that we were clear on is this should be a universal service. It's being distributed and promoted within areas that I'll talk about shortly for all parents. And we've gone out of our way to make sure it's sticky in marketing speak or engaging for the families whose children are at highest risk of poor outcomes. This approach, some of you will know the public health people in the room, the idea of proportionate universalism, a phrase coined by Professor Sir Michael Marmot. So with Baby Buddy, how did we make it? In a nutshell, compressed because of time. This is a flavour of the first several years, from idea to just beyond launch. What you can see is the amount of input. We're not talking a little bit of focus group and then we go away and do what we were already going to do. What we undertook and what we continue to do is constantly listening and learning. And it's that combination of hearing what professionals feel parents need to know in terms of maximising outcomes, and that's crucial, and also listening to what parents want. Because if we don't give parents what they want, they're not going to use it. That's within the confines of evidence-based, clinically assured information. So through that iterative process of co-creation, working with representatives from all the relevant Royal Colleges, we got to a point where, when it was launched, it was endorsed by many of them, and subsequently more have come on board. And I think I need to give a special shout out to the British Society of Paediatric Dentistry that has just come on board. Those of you on Twitter will see that I get brownie points for mentioning oral health. But it is that idea of, it's not health by stealth, because it's not secretive, it's very explicit when you download the app. It's there to support you on the holistic journey that you're on. And we're really proud of the quality assurance and proud to be on the App Store, but the truth is it could be accurate to a T and dull as dishwater, and then no one would use it, which is why user-led design has to be integral, and has been. So the idea of the avatar, and then what the avatar should look like, came from the parents that we worked with in the early days. The idea that you can have over 1 million different avatars, you mess around with the hairstyles, the handbags, you name it. It's a very girly app, and I'll share with you data at the end, which is interesting in terms of highlighting a need. One of the things users also told us is they want personalised information, mentioning you by name, your baby by name. If you're with a partner, mentioning them by name. If you're breastfeeding, supporting that. If you're not hearing about it. So here we have a simple free app that can be personalised and support the preventative pathway. Not instead of, so the geolocation functionality helps you find local services. And one of the key features from the BBC Girl by background are the films. Powerful films, a combination of films led by experts and films led by parents. And the films led by parents have particular traction. When people like you are talking about, for example, smoking cessation, or their mental health, opening up so that you don't feel alone and you know you're not alone. So I do want to just take a moment to thank all the parents who have let our cameras into their lives so that more parents seek help when they need it. Also want to thank the Department of Health and NHS England as part of the national ambition to halve stillbirth by 2025 that we were hearing about earlier. We were funded in collaboration with the charity SANS to make films to go into Baby Buddy. So the idea, once you've got a resource that's reaching the target audience, how that can become a portal to get more evidence-based tool information out to a broader demographic. It's democratising healthcare. And also, users have informed functionality. So we've just launched a 24/7 crisis text messenger. Families want it, and it's professionals that are quality assuring it. So that's about making the app. Now I'm going to move swiftly on to embedding. So this is the second stage, and you may be unsurprised to note that co-creation is at the heart of this process as well. There is no one way of embedding. It is about the bespoke needs, whether we're working at a local authority level or a CCG or an STP, and that particular area and their needs. There are two aspects to embedding. There's multidisciplinary professional embedding, and there's also embedding within community networks. And where we have the biggest impact is when we're doing both concurrently, but the funding hasn't always enabled that. So working with those groups, what we do is develop a local plan. They develop a plan. We undertake appreciative inquiry with them to think about how Baby Buddy can augment and amplify contact points, at what points the app should be recommended, or which films should be highlighted at particular times, or when the goal-setting feature should be highlighted. And also, as part of that, many areas end up taking these little A5 leaflets in the booking appointment letter. So you're getting families at the point where they are most receptive to new ideas. And then at the booking appointment letter, it's reinforced, and at subsequent appointments. What I'm going to do is show you another film that was shot with areas that funded us to embed, and also with parents, to give you a flavour what it means. It was a bit like Simon was talking about earlier, that idea of creating an intervention that becomes business as usual.
Embedding something in practice makes it like business as usual. Everyone knows about it, everyone's signed up to it, and it's just part of their everyday practice.
Anything on your remember to ask list to ask me any questions?
Actually, I do, yeah.
Okay. So one of my young mums, she's had her baby, and when she initially gave birth and she went home, she was having a few problems with breastfeeding, and so we got her using the app with the clips helping with breastfeeding and supporting her through that. So along with my advice and showing her the clips and getting her to have it open and have it there as she was trying to get baby onto the breast, and it really helped her to get through that little rough patch, and she's still exclusively breastfeeding a few weeks later.
I was going through it and I've seen the baby talk video with one of the dads and the baby, and I find that quite funny because he was just repeating everything the baby was saying.
Yeah.
And when I've said it to Shay looked at me like, why would you do that kind of thing? Like, you just talk to a baby, it's like a human, you talk normally. So basically I've shown him that, and then I think it was a couple of days ago, he started copying everything she did.
Yeah.
And she would just start laughing and getting really excited and giving these great responses.
I first heard about Baby Buddy when I was at a conference in Leeds, and there were some flyers around the room, and I picked one up and thought this is really something that I thought would be really useful for our pregnant mums and new mums to be in Blackpool. The information looked really accessible, it looked fun to use. The messages that were contained in the leaflet that I was reading were the messages that we wanted to promote across Blackpool.
Being able to come to you with me being busy or whatever, I can just, especially at night, me and Ryan can both look at it together then.
It's part of our Better Start programme for our conception to 3-year-olds, and Baby Buddy is going to be a major part of the support and information we give out to our young mums. We will be promoting it through all our children's centres, through all our health colleagues, and every which way, wherever parents and new parents go, we will be promoting the Baby Buddy as a source of good quality information to support and enhance what their health professional will provide for them.
With thanks to everyone in that film. So finally, and I'll whiz through it, and we'll be getting the slides sent around later, so you'll have more time to digest them. Some data. As much effort went into the back-end functionality as the front end of Baby Buddy, because we knew we wanted to do this iterative learning. So this is a little window into some of the data that we have, which is this bottom piece. So we know the level of downloads, and we are now at about 1,200 downloads a week, but there's the number of weekly downloads has increased over the years, and this is without any marketing spend. This is mostly through recommendation from healthcare professionals. And Baby Buddy is being used mostly by mothers, which was the primary audience. We'd always planned to make the version for fathers, we just haven't had the funding yet. And despite its girliness, as I talked about, a significant number of users are fathers, and that just identifies a desperate need, something that we're now working within an early years digital partnership that we've convened to work collaboratively with anyone in the room that wants to be involved to address that. We're really heartened that nearly 10,000 healthcare professionals have already registered to use Baby Buddy, because you can only really recommend something with veracity if you've dived in deep and looked at its content and looked at its functionality. And the other thing that the data shows, which is music to our ears within the team, is that just as we set out to achieve, Baby Buddy is being used by parents of all backgrounds. This is mother data I'm going to show you, but disproportionately by groups who are at higher risk of their children having poorer outcomes. So in green, you can see the percentage by age bracket of Baby Buddy users mapped against in orange, or yes, reddy orange, the breakdown of the pregnant population. And there's that overrepresentation of young mums. And if we take the same approach, looking at pop-up questions around your first language, of those people who say English isn't their first language, despite the app being in English, because it's simple, digestible, visual, we have an overrepresentation of pretty much every community language. Now, to really highlight the need for the embedding, that idea of champions, comes the next slide, because nationally, less than 10% of mums use Baby Buddy. It's a very spiky download profile. And what we see is in the areas where we have embedded or where we are currently embedding, the percentage of the mothers in that locality go up, and it fluctuates. So this is just data from the last quarter. And now that Apple don't mean that you can't require someone to give a postcode. It's a slight underrepresentation. But what you can see is in a number of areas, more than a quarter of the mothers are already using Baby Buddy. If you dive in on one area, our data system allows us to give data to the granularity of ward. So you can look at one area at 2 points in time and see the impact of the embedding programme. And what's interesting is the level of usage is higher in areas where we've embedded, not much higher, but higher, but the general feedback is universal wherever in the country you're answering pop-up questions. So I'm not sure if you can see at the back, but you have over 99% of mums finding it easy to use and easy to understand. Crucially, you've got mums reporting that it's helping them look after their mental and physical health, and aligned with our thinking of as well as, not instead of. I'm delighted to say that 89% of mums, of dads, and 86% of mums are telling us it helps them get more out of their appointments. I won't have time to leave this qualitative series of speech bubbles up, but suffice to say the feedback coming through is strong, and we've been driven to create content and functionality to the 4th birthday and for fathers, and we're doing that in collaboration with many other organisations. Thank you very much for your time.